Hi everybody, we hope you're well. According to our last video, following part 2 of the hair loss and baldness, this video we're gonna get into one of the most important and also powerful cause of hair loss that each of us could experience it called androgenic and hormonal hair problems. As we know, a variety of conditions can cause permanent or temporary hair loss, including hormonal changes due to pregnancy, childbirth, menopause, and thyroid problems, and also maturity in both genders. So let's have an overview on the topics we're gonna talk about them. Number 1, let's see which hormones lead to hair loss. Number 2, androgenic. Number 3, thyroid hormones imbalance. Number 4, lady sex hormones. Number 5, me and hair loss. And number 6, my bad habits. At first, we'd better classify hormones that may affect our hair loss. So let's get to the root of the problem. What are these? Testosterone, T3 and T4, estrogen, prolactin, insulin and progesterone. These are the most significant hormones producing in our body that in some situations could lead to thinning hair and then hair loss. The first, what is androgenic hair loss? The derma papilla is the primary location of androgen action, and its migration towards the hair bulge and subsequent signaling a size increase are required to maintain the hair follicle. Senescence via the androgen receptor explains much of the physiology. So in our bodies, we have many kinds of hormones. One of these families is sex hormone that makes sexual appearances. The mother compound of this hormone is cholesterol. Cholesterol in our body glands, for example testes, makes testosterone as an androgenic hormone. Testosterone receptor is available in a different part of our body. One of them is skin. The androgenic effect in our skin makes a higher amount of fat production, causes of acne, increasing thickness, growing body hair, and so on. The adrenal glands make dihydrotestosterone (DHT) from testosterone. DHT has an attenuating effect on follicles of hair. Because of the differences in receptor function and prevalence have more power in our head skin and make a different type of androgenic hair loss pattern. And beneath in the pictures, you can see 8 classes of androgenic hair loss patterns. How can thyroid gland dysfunction affect on our hair loss pattern? A decreased level of thyroid hormones, T3 and T4, in hypothyroidism makes the hair weak and thin. And it's one of the most reasons for hair loss in women. If you have these symptoms, such as chronic low energy and gain weight, as a pharmacist, we recommend you to see your doctor. Does estrogen or progesterone imbalance lead to hair loss in women? And in which period the ladies experience hair loss more? For the first question, the answer is yes. For women, androgenic hair loss is rare because of the amount of androgen is low and estrogen reduces the androgen effect in the skin. After menopause, estrogen and progesterone level come down and may cause androgenic pattern hair loss, but the prevalence lower than men. In polycystic ovary syndrome (PCOS), we see massive hormonal changes that may cause hair loss in women older than 30 years old. What can I do to protect my hair from androgenic hair loss? At first, we have to say if you want to use this drug we mentioned it, you'd better check it out with your pharmacist and physician. We mentioned the reason and this physiologic effect of DHT, so one of the things that may help you is the drug that has an inhibitor effect on testosterone dehydrogenase. Finasteride is an inhibitor enzymatic drug used in androgenic hair loss. Normally using 1 mg per day in oral usage, but this drug is not an OTC drug and you have to see your doctor at first. Finasteride has a topical product too. As pharmacists, we see topical products for hair loss have better effect with lower side effects. But if you are a candidate to use oral finasteride, follow your doctor. Finasteride is forbidden for pregnant women even touching the pill or topical products. If you feel your sex drive is down, you should see your doctor. The pharmacist's recommendation is if your partner is pregnant or has a high chance of pregnancy, you should use condom. And which bad habits should be determined to be avoided. Here, focus on 3 bad habits that we usually ignore them in our daily lives. Avoid using hair dryer just exactly after taking a shower. Avoid using a rough towel for drying your hair. Touching and playing with your hair chronically lead to hair loss. And in our next videos, we're gonna tell you non-pharmacological treatments for hair loss and plants which may help you with this cosmetic problem. We suggest you not to lose the rest of our videos. They would be useful for you. Thank you very much for your cooperation and watching us. Please, if our video was useful for you, support us on our social medias: YouTube, Instagram, and Twitter. Thank you so much for your attention.